How long does it take you to wake up to your alarm in the morning, to wash your hands throughout the day, or to send a text message to a friend? On average, these routine tasks take no more than 30 seconds. During these 30 seconds, someone somewhere in the United States is suffering from a heart attack. What about while you're checking the mail or reheating leftovers from the night before? Every 60 seconds, someone in America dies from a heart disease-related event. Today I'm going to talk to you about the #1 killer in our country for the past 80 years, heart disease. I am currently working towards a career in healthcare and have experienced the loss of a loved one due to this deadly disease. If you or those close to you have not suffered at the hands of this condition, then it may be easy to think that this information does not apply to you. I'm here to tell you that it in fact does. Through research and personal experience, I'm going to inform you of what heart disease is, what can cause it, and how to prevent it, because no matter our age, ethnicity, or genetic background, heart disease is a common life-threatening illness that can be caused by various factors and prevented in numerous ways. First off, heart disease, also known as cardiac disease, is often related to a problem with the blood vessels, but it can also present itself in other forms. Cardiovascular disease is a type of heart disease that specifically refers to a problem with the blood vessels and the heart. An example of this is coronary artery disease. This diagnosis is due to an issue found in the coronary arteries, and they can be diseased or damaged, often because of plaque buildup, which causes the vessels to narrow, allowing for less oxygen to reach the heart. Over time, this can result in a heart attack or possibly death if left untreated. There are many symptoms of cardiovascular disease that are important to know and be able to recognize. These can include chest pain, tightness, pressure or discomfort, shortness of breath, numbness, feeling weak or cold in your legs and arms, or pain in your neck, jaw, throat, upper abdomen, or back. Contrary to this, it is possible to experience what is called a silent myocardial infarction or a silent heart attack. This can be extremely dangerous because it does not always present symptoms. However, this is just scraping the surface. There are many other types of heart disease that only pertain to complications of the heart itself. Arrhythmias, infections, defects, cardiomyopathy, congestive heart failure, and more are some examples. This list of specific conditions that falls under the term heart disease is unfortunately much longer than many people realize. Some of these illnesses are genetic, such as congenital heart disease, which covers several different kinds of defects, as well as hypertrophic cardiomyopathy, which is when the ventricle wall becomes too thick and blood cannot properly leave the heart. Other diseases such as heart attacks, arrhythmias, infections, and heart failure are usually developed over time because of various reasons. Just as it is the case for cardiovascular disease, there are many similar symptoms for these conditions as well. Some not already mentioned include fluttering in the chest, racing heartbeat, dizziness, fainting, gray or blue skin color, swelling, fatigue, and fever. Now, simply knowing what these symptoms are is helpful, but it is even more important that you understand when you should contact your doctor or seek help. According to the Mayo Clinic, any indication of chest pain, shortness of breath, or fainting should be an immediate sign to get medical help. Next, I will discuss the many different elements that may take part in how heart disease arises. There are shockingly so many things that play into the causation of this deadly disease, and in order to know how to prevent it, you must first understand what may lead you to it. When it comes to heart disease, there are many long lists of symptoms, risk factors, treatments, etc. Right now, I would like to focus on the major risk factors for this illness. Some of these things are very much in your control, while others are not. People who have diabetes, people who struggle with obesity, alcoholics, smokers, and people with high blood pressure or cholesterol are all at a much higher risk for developing this disease than others. Although most types of heart disease are not genetic, this is not a guarantee that you are in the clear. Not all of these things can be controlled, and some are hereditary, such as diabetes. Some people may also have a history of high cholesterol or alcoholism that runs in their family. Regardless, living with any one of these factors, or even multiple, does not necessarily mean that you will develop heart disease, but it most certainly increases your chance. Heart disease is the #1 leading cause of death in the United States and has been for the past 8 decades. There are 2 main reasons for why this has been the case for so long. First, being a large portion of our society is not well informed about the issue and often do not know how to help themselves or people they know who are suffering from this illness before it is too late. Secondly, such a high percentage of our population falls under the at-risk category for heart disease because of pre-existing conditions or unhealthy lifestyles. These are both things that can be changed, which is why I am talking to you today. In correlation to the variety of factors that cause this illness, there are just as many ways for you to prevent it. Some of these tools or techniques are very simple to implement and practical for every day. To start, a very crucial and often not thought of way to prevent heart disease is to be aware of your body. You don't have to be an expert on heart disease, just be an expert on yourself. In other words, know you're normal. After being informed of the many things that put people at risk for this condition, it is important to be able to apply that knowledge to yourself. Understand which risk factors, if any, apply to you and what that means for you. Make it personal. Following that, know how to spot the signs or symptoms and catch them early. Seek treatment as soon as you can because heart disease does not have to be permanent. Lastly, here are 3 things you can make a part of your daily routine to help prevent this illness. Number 1 is diet. According to I Am Pro Heart, these are the top 10 heart healthy foods. Whole grains, salmon, nuts, dark leafy greens, broccoli, berries, beans, avocados, apples, and green tea. Try to make these foods a regular part of your diet and eat healthy overall. Second, exercise. Even just 20 minutes a day can make a difference. Be proactive. Third is stress management. This is something that often gets overlooked. Stress is extremely common among our fast-paced environment. It does not seem like that big of a problem, especially considering so many of us suffer from it, but over time, if left untreated, stress can lead to many health problems, including heart disease. In conclusion, heart disease is no joke. It is something that you need to understand and be knowledgeable about. You must recognize its risk factors, work hard to implement a plan to prevent it, and remember that it can be and often is deadly. Hopefully all of this information will benefit you personally and can also be passed on to friends and family so that you don't have to experience the loss of a loved one at the hands of this condition. As Charles C. Hope once said, we can arrange better expectations and better circumstances, beginning with the fact that we need not be who we are now. We can be better.